This 5-minute presentation is designed to discuss Resveratrol and its antidepressant effects. The speaker is Stonefield. Depression is known as an affective disorder characterized by disordered emotions of low mood, pessimism, and low self-worth. Globally, more than 315 million people suffer from depression. It can be a mild condition to a severely debilitating form. Symptoms include low mood, negative thought, low self-esteem, loss of motivation, and adenoma. It lasts about 2 years in major cases, and in cases without treatment has a 50% reoccurrence rate. There are many theories attributed to the cause of depression. The most common one, and the one that drug therapies have targeted, is the monoamine neurotransmitter theory. So this states that depression is caused by a deficit or dysfunction in levels of dopamine, serotonin, and noradrenaline, or a combination of all three. So this is supported by studies that remove the presence of depressive symptoms with use of drugs such as tricyclic antidepressants, monoamine oxidase inhibitors, and selective serotonin reuptake inhibitors. These drugs have targeted the reuptake and degradative pathways to increase levels of these neurotransmitters. The first line of drug therapy for depression is to administer classical antidepressants. These include selective serotonin uptake inhibitors like fluoxetine, which block the uptake of serotonin, tricyclic antidepressants like imipramine, which inhibits the uptake of noradrenaline and serotonin, as well as monoamine oxidase inhibitors like moclobemide, which inhibits the degradative enzymes of monoamines. So side effects and tolerances are common with these types of drugs. Therefore, herbal remedies like Resveratrol are being looked into as alternative options. So Resveratrol is derived from plants like Polygonum capsidum, grapes, berries, dark chocolate, but is in its highest concentration in red wine. The mechanism of action of Resveratrol is similar to that of a monoamine oxidase inhibitor. Zhu, Wang, Yu et al. Showed that Resveratrol leads to increased levels of serotonin and noradrenaline in the synapse of the hippocampus, frontal lobe, and hypothalamus. These areas are involved in emotion and motivation and are therefore linked to depression. At dosages of 80 mg per kilo, dopamine levels were increased. So this is completed by its mechanism of action, which is to inhibit monoamine oxidase A, which is a degradative enzyme which breaks down serotonin and noradrenaline. It has also shown effects to block reuptake of these neurotransmitters by the presynaptic membrane and platelets. So the mechanism of action is shown in the diagram to the right, in which the degradative enzyme monoamine oxidase A is inactivated by an inhibitor like Resveratrol. Levels of serotonin in this case are increased as they cannot be broken down, and this reduces the likelihood of depressive symptoms. New treatments like Resveratrol for depression must have the same or better efficiency than other drugs available. So Resveratrol is preferred due to a lack of side effects associated with it. Yu, Wang, and Chen have associated Resveratrol's antidepressant effects as being highly comparable to the original antidepressant drugs. This was found through the similar values in rat brains for serotonin, noradrenaline, and dopamine after administration of imipramine, fluoxetine, and Resveratrol in stress-induced rats. So Zhu, Wang, and Yu also found similar findings, in which there was no significant difference between the uses of Resveratrol and imipramine or fluoxetine in raising the neurotransmitter levels. They also looked at the activity levels of monoamine oxidase A, which was decreased by Resveratrol as well as by moclobemide, but not by the other two drugs of fluoxetine and imipramine. They also showed that there was no difference in activity between Resveratrol and moclobemide. Absorption and bioavailability of Resveratrol is fairly good, yet it undergoes first-pass metabolism and metabolism to the enterohepatic recirculation to a very high degree. This limits its bioavailability. It is excreted quickly in the urine, shown in the graph over to the right, in which there is a decrease in plasma concentration levels of 500 nanomoles between 30 minutes and 120 minutes. Classical antidepressants, however, have increased absorption and bioavailability as well as lower therapeutic doses. However, they are significantly associated with negative side effects. There is a need for increased dosages of 40 to 80 mg per kilo of Resveratrol to elicit a similar response, yet no side effects are seen with Resveratrol even at dosages as high as 5 grams per day in a tablet form. Resveratrol has only recently been implicated as an antidepressant agent. The human clinical trials that are available seem to revolve around the pharmacokinetics of Resveratrol and also its effects as an anti-cancer drug. The studies that have implicated its use as an antidepressant have used rats as models and based their findings on neurotransmitter levels, monoamine oxidase activity, and a reduction in depressive behaviors. As of yet, there are no human clinical trials to implicate its antidepressant qualities.